Hi, Mr. Jones. I'm Miss Caldwell. I'm going to be taking care of you today, and we're going to need to do some suction and clean your trach and get you breathing better. Okay?
Assess respiratory status of the client to include breath sounds, respiratory effort and rate, and oxygen saturation level.
So I'm putting my stethoscope in, and I'm listening, and he's got some crackles on the right side. He's got some crackles on the left side, and he has been coughing some, so I know that he needs suction.
Position client conscious. Patient in semi-Fowler's position. Turn on suction and adjust pressure 100 to 120 millimeters. Must verbalize.
So I'm adjusting the suction to 100 to 120 millimeters mercury.
Open and maintain sterile field. Unfold sterile cup, touching only sides. Pour sterile saline into cup and put on clean gloves.
And that stuff is in the bottom of the wound care card up there. And I didn't bring it over here. So you need saline and peroxide. We gotta have those. So opening up the kit, get my gloves out, and the cup is up underneath it too. So we still don't have to disturb that stuff. And just be sure you don't shove your hands down in there. That's what should remain sterile. So you can pop it open with your bare hands and get your saline and pour some in it. We have to lip it. This will be a multi-use thing, so we'll lip it and then we'll pour some in.
Okay. Pre-oxygenate client with 100% O2 for 1 to 2 minutes. Hyperventilate with ambu bag 5 times. And replace trach collar, remove gloves, and wash hands.
So I'll take my clean gloves off and wash my hands up.
Okay, put on sterile gloves.
Please watch very closely how she puts these sterile gloves on, y'all. Some of y'all struggle with it still.
With my bare hands, I can only touch the inside of the glove. The outside has to remain sterile.
So anything that's on the inside of the glove can touch your hand, but that's it. Always think that.
With my glove, I can only touch the outside of the other glove.
See how she's doing? Okay, now look. Where's her thumb? Where is this thumb?
Away.
It's got to be up. You cannot touch. Okay?
Pick up catheter with sterile hand. Pick up connecting tubing with unsterile hand. Attach catheter to tubing without contaminating sterile hand.
So this is sterile, and this is unsterile now.
Place catheter into cup of saline to check suction. Remove trach collar with unsterile hand. Insert catheter into trach 10 to 12 centimeters.
And yours will have lines on it. There's a 10 right there.
Apply suction by placing thumb of non-dominant unsterile hand over open port. Rotate the catheter with your dominant sterile hand as you withdraw the catheter. This should take 5 to 10 seconds. Never more than 15. Okay. Replace trach collar. Wait 1 full minute between suctioning and repeat entire procedure if necessary. Must verbalize.
So if I need to repeat it, if they're still crackly, coughing, still sound wet, I have to do this now with one hand because I still have to keep this catheter sterile, okay? I'm going to go through the whole procedure because you need to know how to do it, because once you get this sterile catheter open, you're never going to just pass it one time. You're always going to have to do it more than once. So I'm keeping this sterile. One hand. I got them pre-oxygenated. Put the trach collar back on there. Clear it out. Trach collar off. Keeping this sterile and going in again.
So after you do it the first time, do you have to like listen again? Or
No,
you
it
just...
should be pretty obvious.
Okay.
You know what a wet cough sounds like by now.
Yeah.
And if they're still coughing a lot and it sounds wet, it'll be obvious to you. Okay? So now I'm happy with that.
Rinse catheter in saline. Remove gloves by holding catheter with dominant hand and pulling glove off inside out. Catheter will remain coiled inside glove. Dispose in bag.
And I'm going to be removing this when I do that to get ready for trach care.
Turn off suction. Turn O2 source back to pre-ordered level.
Off.
Just-
O2. Go back to pre-order level.
Okay. Dispose of all supplies. Reassess respiratory status. Note breath sounds, respiratory effort and rate, and oxygen saturation level.
Okay? They sound clear and their O2 sats at 99 now.
Alright, provide client oral care. Universal ending steps.
Okay, Mr. Jones, you did good. Now we're going to have to do some trach care and get the trach cleaned up. Okay, now that we have your secretions cleared up, we're going to clean the trach, okay?
Universal beginning steps. Position patient conscious in semi-phallus position.
Okay.
Assemble equipment. Resuscitation bag connected to 100% oxygen. Sterile towel, optional. Equipment for suctioning. Goggles and masks if necessary. Gown if necessary. Sterile gloves. Moisture resistant bag. Open sterile trachea kit and remove sterile gloves and drape. Drape client.
Be very careful to only touch what I need to get out, only the outside of the package, okay? Outside of the package, and this sterile drape is actually going to be my sterile field, okay? So I can only touch the exposed side of it.
Place all supplies from the kit on the sterile field and place the tray on the bedside table close to the sterile field.
Okay, and so be careful because you see how the stuff can kind of scatter around. So be careful when you do that. Just tip it over like that. Okay, it's really going to be easier to have that out of the way. Okay.
Would your two Q-tips on the outer edge be contaminated since they're outside the margin? Technically?
Yeah, you could report that.
Okay.
That'd be
Yeah.
very good to notify the instructor. Those are too close to the edge, so you'd have to discard those. So we just We've reported
but
that,
really,
so.
in all honesty, you didn't touch anything. I know it's that inch within, but
Yeah,
you still
but I didn't touch anything on the outer
so
border,
it's still okay. She could have, so if it's
If
okay.
they'd have been laying on the table,
Mhm.
definitely, yeah. But if you are concerned about it, always
That's
report
right.
it, because that lets us know, you know where your sterile field is. So that's
Exactly
very
right.
good to be aware of that.
So if it didn't, and you didn't touch anything, okay, and so when could you move those sterile Q-tips over?
You have sterile gloves on?
That's
Have
right.
sterile gloves on.
Yeah.
Very good.
So since we reported it and I was gonna throw them away, we decided I'd keep them, so that was off the record where I moved them.
Pour normal saline into 2 compartments of the tray and hydrogen peroxide in the 3rd compartment.
Okay, so it's, be careful about where you place this stuff, because you don't wanna be reaching all over your sterile field, okay? So we're gonna put saline in 2 compartments. I'm gonna put saline in this one, I'm gonna put saline in this one. I'm going to put hydrogen peroxide in the 3rd one. Lipping the containers before I do this. Lip, pour, lip, pour.
Alright, put on your goggles, mask, and gown if necessary. Put on the sterile gloves.
Did y'all see how she did that? Some of y'all have trouble because you think that that's stuck together. But as long as you're touching the inside, you can pull it apart with your fingers and not be struggling with it.
She just make it look so easy.
I know.
Remove oxygen source with non-dominant hand. Remove inner cannula.
And they all will pop out different ways. This one kind of has 2 little grabbers on each side of it, and it comes out. Some of them you have to twist. Some of them you kind of have to pop out. And tell them where I'm putting this.
Replace oxygen source. Clean lumen and sides of inner cannula using brush and keeping one hand sterile.
So you see what I'm touching? The very outer edge of the cannula. What was exposed? What was on the outside of it, okay? That's what I'm actually touching, okay? So we put it in the hydrogen peroxide, and it's foaming and bubbling because it's got a lot of secretions on it.
Rinse inner
So I'm
cannula
getting
with saline.
I'm getting my brush, and I'm gonna push the brush through here. Get those secretions out. Push the brush through this way. Okay? And I'm gonna have a garbage can right here. And I'm gonna drop it. And I'm gonna put my hand down in the garbage can. I'm gonna drop it. Okay?
Do not stick your hand in the garbage can.
And then I'm putting it in my saline. And I'm rinsing it off.
Okay. Dry cannula with pipe cleaners.
Okay? And one other thing. I didn't do this, okay? I went inside. I need to be sure I go on the outside
Yeah.
of it too. I didn't do that.
Because sometimes, y'all, that thing will be green and funky and all
So
kinds
now,
of dried mucus on
I'm
it.
throwing that away. I'm rinsing right there. And dry with the Q-tip.
Remove oxygen and replace inner cannula. Make sure the cannula is secured.
Okay.
Alright.
Secure.
Replace oxygen source. Clean stoma under face plate using saline and cotton tip.
Okay. I'm using my clean saline over here, okay? And then clean under the trach. Throw that one away. Clean around on the top of it.
You dropping them on the floor is just driving me.
I should have gotten the garbage
I
can.
should have thought about it.
Clean top of face plate in same manner. as
Okay.
what you just did.
Just did.
Pat dry all area with 4x4 gauze. Place dry sterile pre-cut tracheostomy dressing around tracheostoma under faceplate.
And you see it's pre-cut. You can't just pick up a piece of stringy gauze and cut. Those strings can actually get down into the, those strings could actually get down in there. So you want to be sure you always use one that's pre-cut, okay?
So can you touch that with both
You
hands?
can.
Okay.
Cause the sterile part of it now is over.
It was on the inside. So, and we remain sterile even cleaning the outside of it, okay?
Alright, replace Velcro ties while keeping one hand on outer cannula at all times.
Right, so the point of that is keeping one hand on the outer cannula at all times. So you would undo this. You won't use the ties in there. Those are old ties. You have to tie with a bow, and those aren't used anymore. You'll see Velcro, disposable stuff used. So if you undo this side and pretend like this is my brand new one, I'm putting my brand new one in there. I'm never taking my fingers off of there. So I'm putting my brand new tie in there, and I'm leaving the other side still attached. I'm only unattaching one side at a time. So I got this one replaced, and I come around to this side, keeping my hand on there, and
Can you switch hands when you go from side to side?
sure, there's no issue with that. And so there would be my old one, keeping my hands on there, and then I would feed the new one through there. And you could even completely feed the new Velcro through there, and then just remove the old one, whichever you prefer. But just the most important thing is to keep that secure, because there is a cuff in there, but they could cough forcefully enough that it could come out. So you want to be cautious about keeping it secure.
Is that just one long Velcro strap?
Yes, it is. It goes all the way around the back of the neck with 2 Velcro tabs on each end of it.
Remove gloves and discard equipment. Provide oral care.
Okay?
Universal ending steps.
Questions?
I feel good about it.